welcome everybody physically here today and virtually on the Zoom platform. And for those who couldn't be here, we are recording this. So I hope that you will take time to listen because what we're going to be sharing today is information that your own community has provided us. So thank you for being here. Before we get started, I just wanted to say thank you to a few people, especially Robin, Pam, and John, who really do the behind the scenes work to get the announcements out and get this planned and are now working behind the scenes to get this recorded. Thanks to Robin, we have a QR code that was out front and also posted on the flip chart. So please use that to sign in. There will be CME credit and also it helps us keep attendance. So again, welcome. I know it is a Tuesday afternoon at lunchtime, but thank you all for being here. What our topic today is really based on a study that personally I had been thinking about for many, many years. And then Dr. Cunningham, who is an extremely competent, qualified, experienced mentor, faculty member, and he's going to give his official title when he introduces himself, but a collaborator and has taught me so much and has always made my weird, which seem totally abstract ideas come to fruition. So I'm really humbled and grateful for that. So thank you, Chris. So this was a concept that I had, and we were talking about it, and we decided somewhere in 2018 to try to study. And, you know, I want you to just take a step back before we go back. And you are all here today in this healthcare arena. Welcome, everybody. For those of you who are joining, we're just getting started. There is a QR code on the flip chart and up front. If you've seen it, whenever you get a chance, go ahead and sign in. So it's just sharing the birth of this study. So as you're settling in, and for those of you who have been here, just take a pause and think back. Each of you are here working in a healthcare organization or what you would call a healthcare system today. What was it that brought you here? Why? What was your why? What did you write in that personal essay of yours or that personal application when you applied for that position or that role or that training program or the medical school? What was it? And as you're thinking about that, and as we go through this conversation, just think about where is that why today? The other thing we found, or I personally have been passionate, as has Dr. Cunningham, and we started this work around thriving wherever we are, and especially in places where we spend 8 to 10 hours of our quality waking time. What is it that energizes us? What is it that allows us to reset ourselves and regenerate that energy and recharge ourselves while we are in this environment where we give our best, right, of our quality time? What allows us to recover? And we found, you know, over the years that the literature on what prevents that, the burnout, the fatigue, the consequences of that was just flourishing. There was a burgeoning of that information. And yet, personally, I found people around me and myself who continue to find meaning and purpose and who continue to have the joy in doing what they wanted. And so we thought, wouldn't it be lovely to see what is it that really keeps us going in spite of? And not just in the healthcare arena, but even in life. So that was the basis of that study. And it was called the M3 study, Finding and Sustaining Motivation, Meaning, and a Sense of Meaning in Medicine. So a little bit of the roadmap. We're going to just give you a little bit of what the purpose and support was for this program. How did we go about the study? And then more importantly, what are our preliminary findings? And then this is an ongoing project that I think we will continue to invite people to participate. So share that with you all. So I've already sort of given you a little bit of background, but I really want to say a big shout out of thanks to a dear mentor and teacher of mine who was the head of nephrology, Dr. Jackson Yim, and his wife, who they both have been amazing community members and have been very integral to Erlanger and UT, one very senior faculty. And if you go on West Wing 3, you will actually see a plaque in his honor. And they actually help support this work. And then a lot of PhD students and research students that Dr. Cunningham works with that have their names here. So thank you, Jane, Katie, Nolan, and Kobe for really helping with this study. And then I want to say a shout out to all the participants who really participated in this almost 18-month-long study. So, and Dr. Cunningham will give you more about that information. So what did the literature tell us when we started looking into this? I think we all know that we all come to work wanting to do our best. And we get up in the morning and we say we're going to do and give our best. And then when we come to work, we get distracted. And we get distracted with a couple of things. Some of them are personal. We are our own self-critics. A lot of us, me included, oftentimes feel that we are not good enough, we are not worthy enough, that imposter phenomena that we've heard about, and that addiction with perfection in healthcare, especially, that exists, right? And then we are also immersed in an external environment that allows us to feel powerless, whether that is the system of reimbursement that we work around, or the epic moments that are not so epic that we spend with our electronic medical record. And then while we were proposing this study in 2019, we had no idea COVID was going to happen and all the parallel pandemics that occurred. And those stresses are still existing to the point that we have a new term. It's called PTSE. You may have heard about it. The pandemic trauma and stress experience, similar to the post-traumatic stress experience. So that VUCA world that we were living in, that we all know of, the volatile, uncertain, chaotic, and ambiguous world, became even more aggravated. The other reason that we know is that the resources that we need oftentimes far outdo the resources that the system gives to us, whether that is for our physical, emotional, mental, or spiritual well-being. And yet the literature did say that some people continue to find meaning. But what was it that they found meaning from? So where does this motivation that allows us to do what we want to do come from? There is extrinsic motivation, and that comes in the form of awards, praise, career progression, promotions, and compensation also. But there is enough literature to show that it really is short-lived. And it's not long lasting. These extrinsic motivations really do not give that real meaning and motivation that we are looking for. And more importantly, they can be harmful. They actually stifle creativity and that innovation, those top tier of the Maslow's hierarchy of needs, where we all aspire to continue to flourish in. So the other motivation is your intrinsic motivation. And that is really that joy that we feel, that connection, that's something that our why, or what we wrote, the reasons we came into this vocation are getting connected to what we are doing. And this intrinsic motivation is really, there are three factors that really relate to that. One is the autonomy, that having a choice to do, that you feel that your why connects with what you have been allowed to do in your workplace. And you have the opportunity to be good at it, because we are all wanting to be the best we can. And there is a thin balance there, but we want to give our best and be the best. And this was seen during COVID time, where we were asking people who had never taken care of ICU patients to take care of ICU patients. And they were struggling with this because they didn't really know. And that moral distress of, but I want to help, but I'm not trained in this. So how do we help them gain those skills? And then understanding why we are doing. A lot of us come into this vocation to serve, but are we really serving? Or are we stifled in our serving because of insurance companies or the resources available or other factors? And then this meaning and purpose is also closely connected to the people and the community we work with, those meaningful relationships. So are we truly cultivating those meaningful relationships, or are we just existing with each other? And where we are and shift work and other things is really fragmenting how we interact with people. Are we truly listening to understand, or are we in our hospital, healing mode and wanting to fix and advise all the time? So those are, where is that listening empathy in our relationships at this point? So with that, I am going to turn it over to Dr. Cunningham.
Thanks, appreciate it. Thank you all again. It's a real pleasure to be able to speak with you today, those that are here and those that are virtual and those who might listen later. I'm Chris Cunningham. I'm the professor of industrial, organizational, and occupational health psychology at UTC. I focus on trying to help organizations build, design, and sustain healthy and optimal workplaces. So I want to stress something really critical about this particular study is this was not meant to be another study of burnout and how difficult it is to work in healthcare. We've seen enough of those studies, quite honestly. We were more interested, as Mukta pointed out, in trying to figure out, well, how is it that some folks are able to navigate these difficult waters? And more importantly, what can be done within organizational settings to support and facilitate that kind of resilience, okay? So as we get into some of these findings, and especially some of the next steps that we plan to take, I hope you'll understand that that's really what our emphasis is on. We're not just trying to describe the difficulties, but we're really trying to get to the point of interventions and moving things forward in a positive direction. And so as you've seen, our focus with the lead-in that was provided is on really three core components. This idea of meaning and purpose, this concept of motivation, this concept also of social relationships. So you're going to hear those themes kind of come up time and time again. Real quick, methodologically, what we did here is considered an in-depth mixed method study, meaning there's a combination of quantitative and qualitative information being gathered. What makes this particular study different than most is that we identified, we used a technique called Propulsive stratified sampling. And so what that means is we used our professional networks regionally and locally to identify people who work in a healthcare setting who had been recognized by their peers, in some cases awarded, in other cases nominated by their supervisors for demonstrating resilience in the most difficult situations. So in other words, we went out there and actually worked to find people who were resilient in the eyes of the world around them, okay? And then we also stratified this so that we could focus on individuals who occupied administrator leadership roles, physician roles, nurse roles, and other forms of supporting staff roles. And there's a lot of subspecialties that fall into these four general buckets. But I stress this because what we're trying to do with this study is not necessarily target any one of these, but to do a very broad focus on, in this type of hospital setting, for example, what does resilience look like? And what sustains it? And what needs to be put in place to make that possible in the most general way possible? We gathered baseline data from these participants who agreed. Every one of them was called, and we spoke with each of them, give them a chance to understand about the study. We contacted 60 individuals, and 54 of them said, I'm in. Okay, which automatically was amazing, by the way. For those of you that do research, to have that kind of interest and engagement right from the beginning was already encouraging. Even more encouraging is that after we did the baseline survey, the majority of these folks allowed us to follow up with them monthly for 8 months, and then do almost an hour-long concluding interview at the end of the study. And some of those interviews ran over an hour in length. They were willing and able to share so much about their experiences. So I want you to understand there's a wealth of data here, and we're processing still through some of the interviews. So that's why what we're presenting today are preliminary findings. But we are so excited about what we're seeing that we wanted to make sure we didn't sit on it any longer. We wanted to start giving back. As a researcher, it's a rare opportunity to be able to share back to some of the folks that we've actually researched from and gathered data from. And we're both excited to be able to kind of feed that. To give you a quick snapshot of who our core participants were, we actually ended up with a fairly gender balanced sample. There are the pretty typical breakdowns of racial and ethnic groupings, and this is a characteristic challenge for all studies these days. I do want to stress again, our goal here isn't to try to generalize this to broad populations. We really are focusing here on the phenomenon that's underlying. But I will note that in some of the interviews, especially, there's a richness of data that's going to allow us to identify some of these differences in perspective and mindset that may have some sort of cultural connections. And so we will be bringing that up more in some of the later findings. It was interesting to note a high level of married kind of or deep personal connection with a partner and or family unit. This actually plays a significant role later, and when we start talking about the importance of social support networks. And I also just want to stress that this was a fairly well-experienced sample too. So this is the other nice thing about doing propulsive or targeted sampling is you don't end up with a grab bag of folks, some of whom don't even do the work that you hope they do. We weren't randomly trolling the internet, paying for participants through some panel or something. These are folks that actually knew what they were talking about, had a significant amount of experience with what they're doing. I'm not expecting you to see everything here, but I do want you to know sort of the breadth and depth of what we gathered. Don't worry, I'm not going to talk about each and every one of these individually, but there are a lot of different variables, factors, constructs we looked at. Many of these that you see in white are sort of underlying characteristics, dispositions, mindsets, traits. Think of these as personality aspects, more or less, and or perceptions. The blue is a set of core demographics that we would normally gather to not only describe the sample, but to also understand some sort of underlying characteristics that might feed into and affect the resilience of these participants. And then anything in yellow that you'll see on this slide and the next one were targeted questions that we formatted in a way to gather open-ended responses. So when I talk about qualitative data, I'm largely talking about written answers that people provided to some of these types of questions. And then on the next page, you'll see a quick list of the interview prompts that we used. And that's where people were responding. We recorded it, transcribed it, and are analyzing those transcriptions now. Again, there was a lot of depth in these interviews. That's why some of them ran as long as they did. But generally, we were looking at four main buckets of information. One, motivational aspects. The second, meaning, purpose. Third, relationships and connections and how they developed and how they're important. And then the fourth was what you're doing when it comes to self-care and recovery. And I want to stress, even just here at this level, that all of these are very much interrelated, and that's to be expected. What we saw time and time again over the responses of our participants is that we didn't have a strength in one area that didn't positively affect another one of these domains. Similarly, if you had a weakness in one of these areas, it actually bled across and affected some of these other domains. So to be a little more concrete, for most of the respondents we spoke with, when they had recounted positive social relationships and a positive social connectedness with their coworkers, for example, everything else was also operating in a much better way. But when those relationships were failing or struggling, as was the case with some interviewees, when we caught them right during a COVID peak or spike, for instance, and they noted how much their social connectedness had been impacted, all of these other domains was also pulled down by this. And so I want to stress this right here as one of the sort of the initial key preliminary findings. We tend to see in the literature, if you can even get past all the burnout stuff that's out there, if you get into stuff that's focused on resilience, you tend to see a theme and a focus on resilience as some sort of trait. You either have it or you don't. You're born with it or you don't have, or maybe you can learn it, but it's still something that you're fully in control of. And I want to really emphasize and stress that that's not really what our data are showing. There are some underlying individual differences in the way people see their world or the way they make decisions. But resilience goes way beyond just one underlying trait, okay? And it's not just my opinion saying this. I'll be able to show you some data here in a minute that I think speaks to this more powerfully. But I do want to stress that we see opportunities to build and create and sustain work environments where these four factors in particular are elevated and held up as protective factors. In a way, it's kind of like wrapping yourself in a blanket, a comfortable blanket that keeps you, I guess that's really not a good example today. It's hot enough outside that you don't need a blanket, but the idea of being in a comfortable space, right, where you're protected and you know you can lean on others when needed. That's the kind of resilience we're talking about here, is more this aggregate level, group level resilience. So we're going to get into some of the data now, and then I should have also stressed, and I apologize, We are happy also to get into questions and have some discussion, but we thought, just in the interest of time and especially for the purpose of the recording, if we could just save those for the end. So I encourage any of you that are interested in engaging that way, if you could jot down thoughts that you have or things you want to dig into, we'll get into those at the end, I promise. But in general, our main preliminary findings can be summarized in this way. So number one, I told you we went out and tried to find a targeted sample of resilient individuals, but how do you prove that? I mean, like it's nice to say that, but how do you know if they're really resilient? And I'm pleased to say that our data actually do confirm this, and I'll show you some examples of what I mean here in just a minute. The second thing that we found consistently over the quantitative and the qualitative data is that for those individuals who are able to maintain that sense of meaning and purpose, motivation, and positive social relationships, they all reported and demonstrated higher levels of resilience than those who struggled in one or more of these areas. Now, keep in mind, this is already what we call a restricted sample. So they're already high in resilience. So the fact that we can find any relationship at all between these variables and resilience in this very little window tells us just how powerful these factors really are in a broader population. So to put it another way, if we find a relationship here, that relationship is likely to be even stronger if we broaden this out to the broader population of healthcare professionals, not all of whom have similar levels of resilient characteristics to the people that we study. The last portion here, just quickly, is what we saw consistently in the responses of our participants was that self-care isn't something that happens automatically. It really does require effort. But what I'm finding fascinating, especially as we go through the interviews very carefully, is that effort, that set of strategies that people use to engage in self-care, to replenish, to recover, it's not uniform. Now, we've known this for a long time, but to be able to get into specific forms of strategies and yet start to see consistencies across people who come from different walks of life, who work in different areas of the hospital setting, for instance, who have different forms of training, to even start to see some consistency across their different strategies gives us really great hope. Because one of our goals longer term is to package what we've learned and deliver it in the form of interventions that might involve some sorts of education, for instance, some building of organizational supports to facilitate more active and appropriate forms of self-care. And so we'll get into this here shortly as well, so you can understand a little more what I mean. So getting to that first prompt, how do we know that this really was a resilient population? So again, a lot of data here. Don't expect it all to make sense, but let me highlight a few things. As I mentioned, we studied individuals over an extended period of time. I left out month 8 only because at that time point, we saw our numbers drop a little bit because not everybody completed that final survey. So I wanted to give you the most sort of accurate summary of data over time. What you're seeing here is almost everybody who completed the baseline also responded to every month follow-up, which is amazing for this type of research. And again, we can't thank our participants enough for their high-level engagement. But what you should also see is that on most of these variables, there's not a lot of fluctuation here. And that's actually really interesting because these are tried and proven measures that are very sensitive. They do normally show and capture fluctuations. So one thing about being resilient, right, is not just that necessarily you're always happier than anyone around you, but that no matter what life throws at you, you're stable. Okay, so like a large part of the work I do outside of this arena is with companies that are trying to hire the best talent. And one of the things we try to tell these organizations is you don't just want to hire a strong potential performer, you want to hire somebody who's going to be a consistently good performer because you can plan around it, you can manage that. But people who are really volatile, that's really, really difficult to work with. And so we don't see the volatility here, which is one key indication that this is a highly resilient sample. The other key indication is if we look right at the actual line for resilience, which those of you who are here will hopefully be able to follow my red arrow, that's the top line. Now, let's be fair, not all of these measures were scored on exactly the same scale, but keep in mind that about half of these were on a 7-point scale, and the only one that's actually breaking that line right up there is resilience, which was scored on an 8-point scale. Okay, and the point that I want to stress here is that it is showing high-level range restriction. In other words, almost everybody demonstrated the highest possible levels of resilience all across these time points. And the really important point we have to stress is that from baseline through about month 5 was a heavy COVID period. So for those of you that are wondering, well, how did that play a role? With this population, oddly enough, it didn't influence. We've actually run some analyses using hospitalization rates during this time to see if that had an effect on any of these other variables. And it didn't. It really didn't impact. And this is another indication, again, of how resilient this population was. So what I want to stress here more than anything is, if we believe that one of the most effective ways to learn how to do something better, one of the best ways to build mastery, or what in psychology we would call a strong sense of personal agency, one of the best ways to do that is to learn vicariously from others and to kind of follow in their footsteps. And one of the main arguments I want to stress here is, if we want to learn how to build and sustain more resilient healthcare workforces, then these are the people we want to learn from. Okay, this is the kind of profile that we want to try to understand better and try to mimic and mirror. One other detail related to this is that there's, like I said before, a lot of evidence out there suggesting that, resilience is a trait, and there's no fewer than at least 10 measures that I know of that purport to capture that trait of resilience. But what we showed here, and this is from a conference presentation we delivered back in November, is that it's one thing to measure trait. The yellow bar here, by the way, is the R squared. So this is the percentage or proportion of variance accounted for by this model. So I'm not going to get super statistical for you here, but basically the higher the bar, the better the predictive model in explaining the outcomes that you see listed along the bottom. And if all I do is look at your sex, age, and your trait resilience, then yeah, I can explain a little bit of your engagement, about 18%. I can explain a little bit of your well-being. I cannot explain your mental health, and I can explain a little bit of your physical health, okay? But if I factor in, and I add in also your self-efficacy, that's your confidence in your ability to do your work, generally seen as an aspect of resilience. If I also add in your work locus of control, this idea that you believe you have control, as Mukta said earlier, if I focus in this idea of you believing that you're able to flourish at work because you can find ways to thrive, not just survive in that zone. If I add in your core self-evaluation, which includes your optimism, your outlook, your mindset, and if I also factor in your sense of coherence, which is the extent to which you look at the world around you and you are able to see meaning and manageability, and it makes sense. All of those characteristics, by the way, are what in my mind I see as components to true resilience. If I factor those in, look at the increase we get in predictive power, okay? I go from being able to explain about 18% of the variability and engagement to 29%. When it comes to psychological well-being, I go from being able to explain 40% to almost 60%. With mental health, we go from 0 to 11%. With physical health, from 12 to 23%. Now, again, the purpose here, one of the main points of this analysis was to just simply argue resilience can't be understood if all we're doing is looking at it as some sort of static underlying trait. It's much more multifaceted than that. And it involves these types of components. What you're going to see over the remainder of these slides is that it's more than just underlying characteristics. So it's not just who we are and how we see the world. It's also how we are connected to others and how we are connected to the work that we do in that sense of meaning and that sense of purpose. Okay. Did you want to add anything else at this point before we get into some of the call? All right. Have I lost anybody yet completely? All right. Most of you are there. Okay, good. So the next few slides are going to be kind of dense. All right. And this is an unfortunate byproduct of studies that get into qualitative data. As I said, we're still compiling and aggregating these themes, and we'll have pretty pie charts and graphs in another couple of months, but you'll see a few pop up. But what I want you to focus on over this series of slides that follows is the theme label, which will be the high-level bullet point. And then there's going to be snippets of actual quotes from participants helping to illustrate what we're talking about there, okay? I'm not going to read all these quotes because I know you're all perfectly capable of doing that, but I'm going to talk around it a little bit, okay? So when it comes to the theme of meaning and purpose and how that links to resilience, some of the things that we're seeing very consistently throughout the different data collection rounds we did is that this particular group of resilient healthcare professionals generally feels and perceives that their work has purpose. Now, most of you are be like, so what? Okay, but what you got to understand is that's not normal. Like if you look at the broader labor force, not just in healthcare, but across all industries, it's actually quite sad and depressing what percentage of people look at the work they do every day as meaningful and purposeful. So this is actually a huge bonus point in the healthcare arena, is that it's actually higher, there's higher likelihood here than except maybe education, where people will see the work they do as being purposeful. and meaningful. Okay, so that's actually really big. And it's something that was consistent across all of these folks. The other thing that arose a lot is that what they do, regardless of whether they're administrator all the way down to food service staff support folks, I'm somebody who cares. Okay, and it's not just about me, but I'm compelled, I'm driven. It's my vocation, it's my calling. We heard phrases like this time and time again, and these are not prompted by me as the interviewer or by any of our questions. It's really getting individuals to reflect on, how do you see that relationship with the work that you're doing? Okay, so again, there's that deep connectedness. The other thing I need to stress is that when we study things like meaning and purpose, you got to understand you're going to uncover the good and the bad. So yes, on the good side, for those that are perceiving high levels of meaning and purpose, that's super protective. It kind of wraps you in that sort of shell. It buffers those slings and arrows that the day throws at you. On the flip side, when you don't feel that meaning and purpose, or where there's things standing in the way of you meeting that meaning and purpose, that's actually very damaging. And so there's just a couple of comments here at the bottom. And one thing I just have to stress, because I've seen it in several other studies that have been going on over the last couple of months or years as well, is that when that label essential worker got put out there, how damaging that was. Because for anybody who didn't fall into the essential category, it really hurt that sense of purpose, that sense of meaning. And in the broader population, it was often felt that, well, all of healthcare was deemed essential. But for those of you that work in this environment, you hopefully realize that's not the case. There were many individuals in different specialty areas within even this hospital who were furloughed and sent home, and suddenly went from feeling like they were part of a team, a respected, a requisite, a critical part of the team, to being somebody who could just be called as necessary. And it was super damaging to their identities and their sense of purpose and meaning. We're going to feel the effects of that for at least a decade. And it's not just in healthcare, we're seeing it in so many other organizations. Many of you have probably heard about that whole great resignation thing that's been going on. This is one of those contributing factors. Okay, people's foundations have been rocked. And so we see just how important it is to building and sustaining meaning and purpose to kind of protect that connection. We can add a third prong. Meaning and purpose and motivation are actually very closely related, as was highlighted in our introduction. And what we're seeing here across the board with this group is that being able to engage in the direct patient care, being available to others in their time of need, is a common and powerful source of meaning, purpose, and motivation. And I stress this only because at least half the sample wasn't actually able to engage in direct patient care any longer. We had a number of folks who had moved into supervisory roles, who had moved up into more senior administrator roles, or who were working in sort of a support capacity, not directly in contact with patients. Some of this was COVID related. Some of this was because they had been promoted. And yet, when they reflected on what motivated them and gave them a sense of meaning and purpose, this is what they came back to. Think about how powerful that is. You're not even really doing some of this anymore as your day-to-day work, yet that's what's pulling you into this workplace on a daily basis so that you can help others do what used to bring you meaning. That's how powerful this force is. And so some of these quotes, I think, help to illustrate just how deep this connection was for many of our respondents. And I hope you can see the tie-ins there as well. Feel free to jump in.
No, I'll do it.
That's fine. Yeah. If I go too fast here, I know some of you are trying to read through these. I'm happy to flip back as well. Extending their discussion of motivation a little bit, if we just focus on that, there was also a clear connection developing between this idea of maintaining motivation, and as was mentioned earlier, not just the extrinsic form of motivation, but that more intrinsic form where you're driven from within, and how that connects with resilience. And what we found here is that many of the individuals who, again, were in our high resilience sample, noted clearly that what keeps them going is that they view every day as an opportunity to learn and grow. Well, that's a mindset. Okay, so that is a motivational mindset. It's a growth orientation. We know it's good in other areas of work, but we see it's good and protective in this environment. There's also a really consistently strong motivation to just keep doing better at whatever their area of specialization was, but also at a general level. So within the general healthcare field, there were numerous comments made about how, I'm just really impressed with what we've managed to do so far during this COVID period. I'm eager to see how we grow from this and are better able and better prepared to handle what comes next. Again, that forward, that future orientation, that is motivational. okay? Because what it does is it sets us up and compels us or propels us to keep pushing forward to what we're able to do next. But as with what I was sharing on the previous slides, when there are other factors in place that impede or constrain our motivation, this is also very damaging. So one of the most consistent demotivators that we kept hearing about were the documentation requirements and the electronic medical records and the administrative overloads that come into play. I didn't include this additional quote here, but it was well said by one of our participants who said something along the lines of, I didn't get trained in medicine to be an administrator. I got trained in medicine to deliver care. And yet I find that I spend 70% of my day on administrative tasks. And the point that this individual went on to make was, I was prepared to deliver care all day, every day if I have to. But I was not prepared to be an administrator more than I gave care. This individual indicated, I grow from the care that I provide, but I'm depleted by the administrative loads that I carry, okay? And lest you think that's limited to healthcare, it's not. We've seen this kind of pattern emerge in almost every other industry in which there is that divided sort of role that you live, where you're able to provide a service, but you also have to handle this more transactional administrative function as well. So there are work design implications here that we need to ponder, and we'll get back to some of this a little bit later. But I'm sure many of you understand that sort of concept, that theme that's being emphasized. We did get a little bit of the coding done on a couple of these next prompts. So just to share this with you, one of the questions we asked about in one of our earlier surveys was, how do you find and maintain that spark, okay, and to keep coming back into work in this challenging setting? And what I wanted to really stress here, one of the things is, notice that only about 12% of the responses we got here were indicative of taking time off to relax or recover. The majority of these responses came from things that people are doing while working. In other words, working is rejuvenating that spark. It's possible to build and sustain and grow yourself. I'm not saying you don't all need time off. That is part of replenishment. But if we act as if, oh, it's just, burn yourself out at work, you can rest when you go home. If that's the mindset we have, then we're missing the reality, which is that work actually can be replenishing in its own way. And this is interesting because it dovetails a study that we did with another one of my students many years ago, where we similarly showed in another population at the hospital that it was possible to replenish resources during the workday, depending on what you're doing over that period of time. So I think that's pretty interesting.
Maybe I can just share a little bit about that study. So this was for about 4 years that we studied, and some of you are in the audience who participated in that, and it was called RR&R sessions. It started in the Department of Medicine. They were relaxing, rejuvenating, and rejoicing in residency. And these were just open, safe spaces on a Thursday afternoon from 4 to 4:45 or 5 o'clock, where we just came together on West Wing 6, that used to be our conference room, and with a bag of candy. And it was just a conversation around things that inspired us, things that gave us hope, things that surprised us, things that kept us up at night. And it morphed from there to people, the residents, students sharing meaningful quotes, meaningful pictures, painting Christmas cards together, baked cookies were getting decorated. It was just building community. And in that, skills were being taught. It was now equivalent to a wellness time, perhaps, what you would have. But we invited Dr. Cunningham and his collaborator in to really study that. And that paper was published about how these communities that are safe, but that create this meaningful relationships, can be rejuvenating. The word spread, other departments would pop in, allied health would pop in, case management. The dean, Dr. Four, has been there. And I remember I was chair of medicine at that time, and we were in a top CEO meeting when it was a budget meeting, and it was a Tuesday. And I still remember the CEO saying, Mukta, can we have an RR&R session now instead of Thursday? So they can get contagious.
They can. And what was interesting too from those sessions and that particular study, and we see it echoed in these data here, is that often we think that when we interact with others, it is tiring and exhausting and fatiguing and deflating. But what we often forget is that being with others can also be energizing, okay? Especially when we're able to help somebody or impart some training or education or mentoring to that individual. In that previous study, we also found like little things we often forget, like one of the most surprising findings was people indicated that charting was actually relaxing and recovering. And we're like, that's interesting. Why? Because that was when they got to sit down. That was a chance to sit down and collect their thoughts and clear their minds before they went on to whatever came next. And the point to stress here is that it's not really possible to segment work and recovery at work to at home, which is what so many folks are trying to do right now. And especially in this type of occupation, if that's what we tried to do, folks that work in this setting would be really out of luck because while you're here, there are going to need to be moments where you can replenish and rejuvenate. So this is very hopeful data, I think, is the main point to emphasize, and there's even more of this coming. One other thing we dug into is what are some resources or aspects, characteristics of that work environment that help to maintain your motivation even when work is difficult. And I mean, I didn't choose the colors on this because I like the ones that automatically popped up when I graphed this, but you can't ignore that the big one is social support. And this is very exciting to somebody like me because the evidence on social support is unmistakable. And what's also really powerful is that this is not something that each individual has to choose for themselves. Social support can be designed into the way that we build our treatment teams, our work organizations, our facilities, how we schedule people, how we assign supervisors to their staff, how we mentor people, how we train people, how we educate people. Like this is a design decision, which means it's actually something that we can act on. So that was really powerful. The other thing here that's powerful is to recognize that the work itself can be motivating. And again, in my domain of industrial psych, we've known this for 150 years plus, but you'd be surprised how few jobs out there are designed in a way that encourages that motivational potential, okay? And if we have a little time at the end, I'd be happy to go on that tangent a little bit, but we already have known this for decades. There are certain ways you design work to maximize motivation, and there are certain ways you design work to minimize motivation. And unfortunately, especially in healthcare environments, the latter is more common. We see the motivation being minimized by a lot of those design decisions. Moving into the next theme here. Again, we focused also on social relationships. You saw in that previous graphic just how important they are to sustaining motivation, but how do they contribute to resilience? And what we are hearing and seeing time and time again as we plow through these data is just how critically important the presence of a mentor, one or multiple mentors, was during the individual's formation. Whatever their professional specialty might be, what they went through educationally, what they went through personally, has helped them to develop the approach or the strategy set that they use now to stay resilient. But in addition to that, not only historical importance of social relationship, but the present importance, being surrounded by colleagues, supervisors, peers, teammates, whom they can trust, whom they can be authentic with whom they can joke and laugh and have some fun, even when the times are difficult. We're hearing this time and time again. And then what was also interesting is this really strong theme again emerging, that it's not just the connections that I've had in my own life and with my coworkers or colleagues, but it's the social relationships that I'm building even temporarily with my patients or with the families that need me at that moment in time. When you step back and look at some of these data, you can't help but think that even though this is a study of healthcare professionals, it's really a study of relationships. Okay, there's so much there that plays a role in all of these different themes that we've been exploring. So hopefully you can see, in these example illustrations, and again, these are just three of many, 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 about highlighting the emphasis or the importance rather that mentors have played. What are implications of this? Well, again, mentoring can be built into education. But right now, we don't really think a lot about how we connect people with mentors who can help you to build your resilience or to build your self-care or to build your ability to relate with other people. We focus now often on assigning mentors who have expertise in a particular technology or treatment paradigm or knowledge base. And these individuals might not always be the best mentors for some of these other aspects that we want to promote. So there are real implications here for how we go about doing that. When it comes to relationships and resilience, we also found, again, repeatedly, the importance of good communication patterns and trust in team members. And here's the interesting thing about that. Almost nobody receives education on how to be a good team member. So as a result, how we behave in teams is a trial and error learned experience that most of us have. Often it's shaped and clouded by lots of bad team experiences that we've had over our past educational years, especially. But that doesn't have to be that way. There are actually ways to teach teams how to form effectively. There are ways to educate and promote good communication, to facilitate positive team interaction. And when you do that, you actually create structures that can exist in perpetuity. This is, again, a design function. It doesn't rest on one individual, but it actually becomes part of the way that we approach work. Now, on the flip side, of course, when that social support or that positive social relationship isn't there, we also started to see themes of negative impact on the individual. And you can kind of get a hint of this in this one quote that I pulled here at the bottom. You know, just this idea of people just missing the point. Like the lack of support from higher ups in this particular example made them feel like what they were doing didn't matter and made what they were doing so much more draining. Whereas if they had been able to even just receive a pat on that back or acknowledgement that, hey, you had a really tough day, great job getting done what needed to be done, patient care. But we have this other challenge that we have to deal with as well. So thinking about how there's this double-edged sword here. I won't go on this tangent right now, but it is interesting to note, quick sidelight, not all social support is good. Okay, so sometimes we get in people's business and that causes more trouble than it's worth. But by and large, when support is there, when we need it, that's one of those what we call buffering factors or protective factors that we want to see more of. And these data support that as well. And then getting into that theme of self-care and resilience a little bit, what we are seeing, and this is the part where we still have more analysis to go for sure, but self-care is insufficient by itself to sustain the resilience, but it is an essential factor that is in the minds and practices of our participants. Now, how we know this is that we had some very targeted questions about, you know, for instance, what do you do to make sure you're ready for your next work period? What are your routines? What are your strategies? And I've asked questions like this in other studies with more general populations, and I can tell you a lot of people will honestly say, I don't. No. But this population, that didn't happen. This population, every single individual was able to say, even just maybe like one mild prompt of, really? And they would say, you know, you're right. Like, I do this, I do that. Well, what are they doing? Well, they're doing things like following the strategies that their mentors showed them about maybe, you know, for instance, learning to detach and segment from work, putting time on your schedule to connect with a spouse or a partner, carving out time with your kids, making sure that you're not too proud to get help with house cleaning or purchasing groceries or things, whatever it is that you need, in other words, to make that time available for yourself. And also making sure that you're making replenishing and restoring a critical priority. That is echoed here time and time again. So the big takeaway right now is that self-care is not just happening, but there are clear and consistent strategies emerging from this population about how we make it work. And one of the biggest ones that we're seeing is the importance of being really rigid about detachment and segmenting one's work from one's personal life. Now, again, for most of the people in this room, you may be like, well, yeah, no kidding. I mean, isn't that what everybody does? But no, it's not. Actually, in the broader world, there's a big push right now toward not doing that, toward creating permeability. This whole work from home revolution that everybody's buzzing about in the business world, it simply can't work for many types of occupations. Healthcare is one of them. But even in many of those business settings, this high that people are on right now is going to come to a crashing low very, very soon. Because when we allow life domains to bleed into each other constantly, all we've succeeded in doing is creating constant interruptions and an inability to focus on what we have to do at that point in time. So it stands to reason this population would see the benefit of detachment segmentation, but some of the strategies that we're hearing are just brilliant and really clear and really easy to generalize and share with other people. But what makes me sad so far is that when we've asked individuals, how did you learn that? How did you figure that out? Where did you learn that? Most of them are saying something along the lines of, well, that's not a pretty story. You know, it cost me my first wife, or this, I'm in the middle of the divorce right now, and that's when I figured it out, or I burned out years ago and then come back. And so the problem is these strategies are transferable, they're generalizable, they're shareable, but this population had to learn it the hard way. So one of the next questions for us is, can we teach these in advance? Can we get to medical students, for example? Can we get to residents? Or can this only be learned after you've had a life crisis that makes this relevant? That's part of what we're teasing out of the data right now with respect to this dimension. Last comment I'll make on this one is interesting. We've also seen consistently people in this sample being attentive to what we would call micro opportunities for joy, ways to inject happiness, ways to find a smile, ways to make somebody else laugh, ways to demonstrate compassion. And I want to stress again, this dovetails that earlier study we mentioned. When we talk about replenishing or recovering, we don't have to talk about grand gestures, long weekends away or full out vacations. Sometimes it's as simple as having that moment where you laugh so hard that you lost your breath, or realizing that it's a nice day and eating outside in the courtyard rather than eating at your desk in your cubicle, or smiling and realizing that that made somebody else smile, which then made you happy. These little momentary things are showing up in these responses as being part of their replenishment strategy, okay? And again, to go back to a point made earlier, if these strategies work for this population, think about their ability to work for others who don't have any strategies, for others who are struggling in very real ways because they don't even know where to begin, or they don't feel like they have any time or any control over how they can recover and how they can replenish. Much of what we're talking about doesn't require a lot of time, doesn't require a lot of effort. It becomes a way that we approach the work that we do. So that's very hopeful. On the flip side, we did ask, what are some aspects of work that get in the way of you recovering the way you want to? Okay, and again, not terribly surprising, but it is interesting to note, even in this highly resilient sample, a sample that we would generally look at as having their stuff together when it comes to recovery, especially when we look at their strategies, like, wow, you guys really got it. Many folks understand the science of it, the research on it. Even this group is reporting that work continues to get in the way. Now, what do we do about that? Well, that's a very complex question because this is part of the nature of the beast. But what it also does stress is that if these folks generally know what to do, but work is disallowing them from doing it, then what it highlights is the need for us to do something in that work environment to make it more possible for these folks to exercise these strategies, to leverage that mastery, that sense of personal agency that they have to engage in the recovery that they need. In other words, try to figure out what we can do to get out of people's way so they can take care of themselves the way they need to, okay? And there are some interesting models and techniques being used in different industries that we do think can transfer and apply really well within hospital and general healthcare environments. And that's part of what we're exploring next as well. So when we do talk about next steps, I try not to plan out more than 9 to 12 months. So where we're at with this particular project is targeting what you see here. So we're working through the rest of these interviews. Everything's been transcribed, coded by at least 2 members of my team. Dr. Pan and I are now processing through these and doing a final review and consolidation of it. We expect to see all those data points summarized here within the next few months. We've also started preparation of a handful of manuscripts based on some of the preliminary findings that have been summarized briefly today. And those will be getting submitted for review. We've identified a couple of conferences that we'd like to share some of this at, and then longer term, we're planning to develop out what we're seeing into intervention strategies. And when it comes to intervention, the approach that really is surfacing as being most relevant in this setting is one that's recently become known as the Igloo Approach. And if you're curious about this, I encourage you to read the work of Karina Nielsen and colleagues, who they've been the ones that really promoted this most heavily. But the Igloo Approach, what it does is it forces us to take a multi-level, multifaceted perspective on not only intervention, but how we evaluate that intervention. And what we're talking about here again in this study is how do we build and sustain resilience? Not how do we avoid burnout, but how do we build and sustain resilience so that no matter what's happening, this workforce can keep going. And what it requires at a real high level is targeting individuals, yeah, but that's not enough. Targeting groups that they work in, targeting the leaders of those groups, targeting the organizations, and then also having an effect through the overarching context. So without getting into too many details, if we just took this one hospital as an example, what are some things that we could be doing? Well, overarching context, that's our community. And in the community, think about where this organization has support and where it doesn't, where it has access to other resources it needs, where it doesn't, and what can we do to strengthen that? At the organizational level, you can think about things like the strategic plans and the way that the organization's structured and the way that the organization's led. At the leader level, we're now talking at lower levels, now getting to levels of divisions, departments, groups, functional areas. What's that structure like? Who's leading those? In the group settings, what can we do to improve the positive social connections, the good communication, the trust, the authenticity that we spoke about earlier? At the individual level, what can we do to help people recognize when they need more self-care and recovery? How can we help people develop strategy sets that they can work with? And then how do we then reinforce all of that with what's happening at each of the other levels above? So what this model does for us is it allows us to take a more holistic and multifaceted perspective on these matters. It's a similar model to what we use when we help new companies, startups, design a structure and a set of functional processes from the ground up. But you can use this to also engage in redesign and organizational development efforts as well. And so that's one of the kind of exciting areas we're planning to go in intervention labs. Did you have anything else you wanted to add here? Just shift to questions then? Yeah.
5 minutes.
5 minutes and then more for anybody who needs or wants to stick around. That's where I stop.
Yeah. No, thank you all. And we'd entertain any questions. And I think Pam and John in the back can let us know if there are any questions in the chat. Any thoughts, comments, suggestions, questions, clarifications?
Said too much. Does this resonate or click with any of you? I saw a lot of heads nodding, and I don't think you were falling asleep. I'm pretty sure that wasn't it. Yeah. All right.
Yeah, when we thought of this study, we were very optimistic. And after seeing the results, I am not just optimistic, I'm very hopeful. I think, we often can get bogged down with the immense negativity that we are seeing all around us, whether it's on social media or otherwise we read about it on the television. But, I think we've talked about burnout and stress and other things as the tip of the iceberg, and we've been sort of challenged to see what's below the tip of the iceberg. I think this study helps us understand and prevent the iceberg from even forming. And I think that is what gives me hope and really keeps the optimism, I think, going. The other thing I was just going to say a few words if there are no questions in the chat. Yes, Andrew.
You said that you select this population of people who had high levels of resilience. So did they know that's why you chose them? Just like, did you get any indication that these people knew that they had skills?
Yeah, no, it's a great question. And sometimes we really worry about that because, if you prime somebody right at the beginning of a study, then there's these what we call demand characteristics where people respond the way that you think they would. Many of them figured it out. The vast majority, we just indicated that we had gotten your name from so-and-so, and we were really hoping that you'd be willing to participate. The way we had positioned it to most folks was that we know you're a highly engaged healthcare professional, and we know that you care about health and well-being issues at a more general level. But truth be told, once you start getting into questions, it's almost obvious to everyone, like, my approach to this is different. Like, I heard so many people say that, even like, that's an interesting question. The way I would respond to this is different than what most of my colleagues would probably say. Or, I've thought about this quite a bit and my perspective is different. So it became apparent, but there is no indication based on the survey responses and then the later interviews that we've conducted that it somehow skewed or that we got false data. And that's one of the beautiful things about being able to gather data over such an extended period of time. The consistency, again, allows us to validate that within person, we're seeing that true individual. Thanks for the question.
For the purpose of the audience on the Zoom platform, the question was for those participants that were selected, did they know that they were they identified up front as being resilient? Thank you. Anything else? So I'm just going to summarize that first. Again, thank you to a lot of people. Some may be in the audience, I don't know, for those who participated. We have been called to consider what we are seeing around the globe as the Great Resignation. I think we should think about it as the great reimagination. And I think this data that we have here in our community is so robust that what can we do to empower ourselves, but empower each other and really speak as a united voice to look at what can be done to promote relationships and relationships that are meaningful and trustworthy. That would help build that social connection that we found be so important. The other thing that we found is that words matter. And things like essential, non-essential, the word hero was used many times, and that was damaging in many ways. So how can we be mindful of the words we use and think about it?
And I'd say also the words we don't use. One of the other themes that came up a lot was the need for acknowledgement, not like a praise like, wow, you're amazing, but just acknowledging the effort that people put into the care of an individual or the support of a colleague. The little things we can do by just injecting words into our day-to-day basis and not assuming that somebody knows that you appreciate them. That was another point.
Yeah, thank you. And I think one thing that we can all start to do, which is a common theme that has come up, is everybody wants few things: see me, hear me, give me a voice, and show me you care. And we can all do that, even if you don't agree with anything. But how can we acknowledge that I see you and really mean that? Do you have anything to add? It's not right or wrong, it just may be different, and just thank you. So thank you all very much for being here.
Thank you.